Shelby County again under scrutiny for how it awards contracts to those wishing to do business with the county. This time, a healthcare provider is raising red flags about mental health care services in the Shelby County Jail.
WREG investigator April Thompson shows what happened and the impact all of this could have on life and death situations at 201 Poplar.
Justice for Joshon!
Justice for Joshon!
Justice for Marcus!
Justice for Marcus!
Families joined together by pain. They lost a loved one in a place where there is supposed to be supervision and protection. 201 Poplar, the Shelby County Jail. Marcus McDonald's family says he had a mental health crisis in May of 2022. He was detained by the Shelby County Sheriff's Department, but they say he was never given the mental evaluation that he was supposed to get. Instead, he was placed in a cell with an inmate who strangled him to death.
We know that justice will be served.
That's right.
And that's all that we can ask for at this point.
His death is just one that happened at 201 Poplar. WREG obtained records showing 20 inmates have died while in custody since 2022. WREG asked for a cause of death for the inmates. The sheriff's office says some of the inmates died from heart issues or drugs. At least 2 died by suicide, and an autopsy is pending on others. Several sheriff's officers have been indicted in the death of Gershon Freeman, even though his cause of death was listed as a psychotic disorder.
There's many people that's in that jail with mental health issues that don't need to be in jail.
Shelby County Commissioner Charlie Caswell is concerned. While the Shelby County Sheriff is responsible for the jail, the County Commission approves contracts deciding who provides services there.
And I saw it with my own eyes, individuals that was in there screaming out for help. But then we don't have the proper services or the capacity right now to provide those services. So that's what I'm focusing on myself. For many years, been fighting about the mental health and the trauma that these individuals are sitting in our jail with, that they need to get that addressed.
One big decision on who will provide mental health care to inmates is expected to go before commissioners soon. And already there is controversy.
We submitted.
Dr. Kave Ofo wants to provide health care to the inmates at the Shelby County Jail.
I was disturbed by reading the news, the negative media coverage about the number of deaths that has happened in Shelby County Detention Center, Shelby County Correctional Facility. So I was disturbed by that, and I thought they need help.
His company, Medico, was one of 3 that submitted a bid. He admits that the almost $37 million bid wasn't the cheapest, but he says it provides the professionals needed to treat inmates. And he says the bid selection committee was well aware of that.
They knew the level of staffing that we provide, the price difference, their background, their recommendation letter, the scope of work. Our proposal was 1,100 pages. And despite all that, having all that information, their own selection committee scored Medico the highest.
WREG received the score sheet for those who bid on the contract. Medico did score a 93, the highest of the 3 bidders. So Dr. Ofo says he can't explain why the bid is going to WellPath, the company that came in second by 2 points.
I was shocked. I was shocked that why would a county would not respect their own selection committee decision.
Dr. Ofo says he got this rejection letter. He also showed us what he says is the congratulatory letter the county sent WellPath that did provide the cheapest bid. But was it premature? The county commission has the final say on who will provide health care services. And right now, the vote has not even gone before the commission. Shelby County Mayor Lee Harris told us WellPath had a lower cost, but he wants to look at providing services so those with mental health needs don't end up in the jail in the first place.
We need to build a new building in Shelby County that delivers mental health care access to folks in that jail who are eligible and need it. We need a stabilization program that we administer that lasts for 2 weeks and that gets people out of those jail who are eligible, gets them into a program, gets them back on their meds, and gets them back as productive members of our community.
$50,000 $100,000.
Shelby County Commissioner Brittany Thornton has heard plenty about the dilemma, including the long time WellPath has had the jail health care contract.
I mean, I feel like 17 years of having access to a jail contract, it just makes you ask questions.
If you read this,
Dr. Ofo says he wants to provide something different.
we have to be more proactive to hire higher quantity and higher quality of healthcare professionals at our correctional facilities, especially in inner cities like Memphis. Otherwise, nothing will change.
A final decision on the jail health care contract is expected soon, but it also highlights what has become a big issue in Shelby County, the awarding of contracts. We'll show you just how much progress the county has made in the face of some lawsuits, and also who is pushing to make change. In downtown Memphis, April Thompson, WREG Investigators.
A good behind-the-scenes look at those contracts. And we contacted WellPath for comment, but we have not heard back.